Sorry, just let everyone know the live stream's up.
Give me 1 second, guys. Just got to get the. Right, it is 12 o'clock, and at this time, I would like to call the Human Services Committee meeting to order. And first item for us today is approval of the agenda. So we'll be looking for a motion and support to approve the agenda. Are we ready to go, or should I wait? I can't hear anybody else yet, so.
Yep, I'm good on. You're good here.
I'm good.
Okay.
Are we missing anyone?
Okay.
I'm ready.
1, 2, 3. I only see 4 of us, Daniel.
Okay, I will hang tight for a second.
Who's the fifth one you're looking for?
Commissioner Pulaski.
Earl Pulaski.
Oh.
I don't see him on here yet.
Hang on just a couple seconds to get to get in like quick, and then we'll get started in about 2 minutes.
I'm bringing Earl in. Hold on.
Thank you, Michelle.
You're welcome.
Thank you. I'm sorry. I think I had the wrong link.
That's
Okay.
okay. We are just getting
Sorry, Mr.
started.
Chair.
No problem, no problem. So at this time, we will call the meeting to order. And first item for for us today is approval of the agenda. Just looking for a motion and support to approve the agenda. I see Earl. I can't see anybody else's camera, unfortunately. I see Carrie Ann's camera. Can't see anybody else. I
This
don't
is
know.
Tony, support Earl's motion.
Okay, thank you. It's been moved and supported. At this time, all in favor, say aye.
Aye.
All right. Okay. Thank you very much. I don't know if my connection's bad or what, but I'm okay. There we go. Now the cameras are popping up. All right. So motion passes. Next item on the agenda is public comment. Do we have any public comment today?
No public comment this afternoon.
Right. Thank you very much, Michelle. Next item on the agenda is the minutes from the June 8th meeting. We'll be looking for a motion and support to pass the minutes from our June 8th meeting.
Move to approve the minutes from June 8th.
Moved by Tony, supported by Darius. All in favor, say aye.
Aye.
All opposed, the same. All right, minutes per day is we have appointments. Let's see here. So we have one applicant for consideration for today, and that is going to be under the Sanitary Code Board of Appeals, and the applicant is Greg Warblow. No current members on that entire committee, so we would just be looking for a motion to move his name forward to the full board for consideration.
So moved.
It has been moved. All in favor, say aye. All opposed, the same. All right, thank you very much. So again, we do still have some open positions on that particular committee. Next item is Lifeway's monthly report. I did get an email saying that Mary Beth is not feeling well, but their report is attached. I'm not sure if anyone from Lifeways is available to speak to that report. Per that email, I know that Mary Beth will not be here today. So at this time, I guess we can move forward from that item. And if you have any questions, just contact Mary Beth or someone at Lifeway with your questions, and we would look to hear from them next month. Next item on the agenda is the medical care facility report. You have anybody from the medical care facility?
Yes, this is Destiny. I'm here to report for the medical care facility.
Hi, Destiny.
Hello. Okay, so for financial, I have April and May's financials. So I'll share those with you, and I believe those were provided to you in your packet. So financials for April showed a net gain of $325,000. This is above budget by $438,000, as the facility had a budgeted loss of $113,000 for the month of April. Revenue was over budget by $373,000, and this was the result of one advance payment from Medicaid in the amount of $86,079.17 received on April 2nd, and two Medicare grant payments received on April 17th in the amount of $184,111.48, and April 24th in the amount of $210,054.07. In addition to these grant payments, the facility also received $104,888 from the county to reimburse the facility for covering costs of the renovation project in early 2019 due to a shortfall in the MOE account. as expenditures that exceeded the collected tax and the cost of the annual MOE payment to the state of Michigan during that time period. Expenses were under budget by $65,000. The census averaged 181, which was lower than budget by 3 beds for the month of April. For the month of May, financials show a net gain of $271,000. This is above budget by $321,000, as the facility had budgeted for a net loss of $50,000 for the month of May. Revenue was over budget by $377,000, and this was the result of a Medicare grant payment received on May 22nd in the amount of $535,000. Expenses were greater than budget by $56,000, and this is mainly attributed to increased overtime and COVID-related expenses such as personal protective equipment. The census averaged 177, which was lower than budget by 7 beds. For our turnover rate right now for 2020 sits at 10.63%. We have no outstanding grievances from M&A or AFSCME 2098A, although we do have one outstanding grievance from AFSCME 139 regarding a termination. We also approved a short-term contract with AFSCME 139 on April 27th at the board meeting. That short-term contract caused the contract time to expire at the end of the year, allowing us to do wage reopeners at the same time as a full contract negotiation. For our mandation trends, we continue to have call-ins greater than the number of mandations, with the average number of mandations per month for CNAs at 6 mandations per month, and the average number of mandations for nurses at 4 per month. In quality, we are currently ranked as a 3-star facility. We have 4 stars in quality and 5 stars in the staffing components of the CMS 5-star rating. Antipsychotics are slightly below state and national averages, with both care and cost quality measures being in good positions. We continue to have a number of quality projects as we work through COVID as well, including looking at PPIs and acid suppression, long-term use of Coumadin, fall rates tracking and trending, the use of mechanical lifts and transfer audits, medication pass audits, kitchen and food prepping audits, call light timing reports, informed consents for anti-anxiety and antidepressant medications, and contact time audits. On May 20th and 21st, we had a survey regarding infection control. This is a survey that's solely focused on infection control due to COVID-19. That resulted in 1 F-level citation due to care partners not being able to articulate how long a surface had to be wet while using a disinfectant wipe. So because they weren't able to articulate that to the surveyors, although they see no issues with the cleaning itself, the fact that they couldn't articulate it meant that we received a citation. We did appeal that citation and lost that appeal. The citation was cleared by desk review on June 16th. Overall, we have continued to have no positive residents for COVID-19 during the entirety of the pandemic, with 351 residents testing negative. We currently have 22 pending tests from one of our testings that we did actually at the very beginning of June. And we're still awaiting those results from when the National Guard came out and did testing. For our care partners, we've had 2 care partners test positive since the beginning of March. One of those was on May 10th, the other was on June 13th. We've had 1,201 negative test results, and we currently have 11 pending test results. For our care partners, we are required to test weekly, and that is being done each week. The lab that we've contracted with has been very good about getting our lab results quite expeditiously to us. And I believe that is all that I have to report. Is there any questions I can answer for you?
Commissioners, what questions do we have for Destiny today? Darius?
Hi, Destiny. I just have one question for you. You mentioned that we have a 3-star ranking, and I may have asked this before, but do we have a plan to raise those standards, the 3-star and the 4-star, so we could have a 5-star rating in all areas?
Yes, sir. And in fact, since I reported last, our quality measures have gone up 1 star. So we were at a 3-star the last time I reported, and now we're at a 4-star. So we are continuing to work on that as well.
Wonderful. Okay. And then how often, I think you just mentioned this, and if you did, I apologize, but how often are employees tested for COVID-19?
Right now it's weekly, and that's based on the My Safe Start map that the governor has put out. When our risk level drops to low, then we will no longer have to test. But until then, it's weekly.
Okay, and what is the risk factor right now? And when you say risk factor, are you talking about those in the facility, or are you talking statewide?
We're talking about the region that has been set up by the state. So our region is Jackson, Hillsdale, and Lenawee County.
Right.
And right now the state is viewing us as medium risk.
Okay.
So once that drops to low risk, then we'll no longer have to test.
Okay. Okay, thank you. Thank you, Destiny. Mr. Chair, I have nothing further.
Mr. Kennedy?
Just a quick comment, looking at your operating statement, we're a little over $500,000 in the black. I'm reading that correctly?
Yes,
Okay, and that was mainly attributed to grants coming in?
that is correct.
I'd just like to express pleasure in that and thank you, because I know the board had expressed some concerns with being in the red. So I'm glad that it was addressed, and obviously I'm happy with the path we're on now.
Thank you very much. I do want to just point out, as good as those financials look, all of that grant money does have to be spent on COVID-related expenses, but it can be used to cover lost revenue during COVID-19, which is what we're primarily using it for right now.
Could you provide a couple of examples of that?
So for instance, right now our census is down considerably from what our average has been. And a lot of that was due to a period of time where there wasn't any elective surgeries being done. But also because we have more family members that are choosing to take their loved ones home because they're unable to come and visit. So we've also had probably about between 5 and 10 families that have transferred their loved ones to the hospice house where they're able to visit, where they're not able to come here and visit because of the guidelines that we've been given from CMS. So those things are what we're looking at in terms of lost revenue.
Okay, thank you.
You're welcome.
Any other questions or comments today for Destiny, commissioners? Destiny, thank you very much for the report. I just want to say excellent job, although I know it's probably kind of like coincidence because you can't really control where COVID ends up at. But I do think it is definitely worth giving you some honor for the 0 positive test in our aging population in the medical care facility. I am curious myself if you foresee or have any budget concerns that you'd like to discuss with us that we may be able to help you with, or present some options or something that we may be able to help you with. Because what it sounds like you're saying is, while on paper it does look like the deficit that the medical care facility has found itself in is only looks like it's gotten better because of the grants that we've received. But I'm curious about moving forward, and even outside of the grant money where it can't be spent at, are there areas of concern or areas that we should be concerned about?
Well, I think that wages have been a challenge for us in our budget from the very beginning. And that is one of the areas that as we move towards the end of the year that we could see some challenges in, although some of that money can be spent towards wages, because we are seeing an uptick in overtime because of COVID-19, people having to be off longer pending tests and things like that. And so we're trying to make meticulous notes about where that money is being allocated. So some of that will go towards wages, but that is an area that I think is where we've struggled the most throughout this year, is seeing an increase in wages that we hadn't necessarily thought was going to be there. That being said, one thing I do want to note is that any money that we spend on wages is reimbursable through Medicaid. And I think sometimes I don't always say that in this meeting. And so I just want to make sure I take the opportunity to say that, because the money we spend on wages goes into our per day rate of pay that we receive from Medicaid. So even though we've seen that issue last year with wages, that will get reimbursed to us over time through the Medicaid rate. But it doesn't look good on the upfront. And that's something that there's several different areas that have had higher expenses than what we had anticipated last year specifically, that we should be seeing that coming back in the Medicaid rate on October 1st of this year. So I do think that those things are going to work themselves out, and then we'll reach kind of a plateau with that growth, because we have been in a period of growth since that renovation was finished in early 2019. Does that answer your question?
It does. Thank you very much. I appreciate that. That's actually really good to know that those wage rates will be reimbursed. So that kind of answers it. And maybe at some point I can set up a meeting with you, Destiny, so that I can have a better or clearer understanding of the financials myself, because I'm sure I have more questions and just not quite sure where to ask them at. One thing I did have an additional question about / recommendation is the issue with like kind of losing some of our people from not being able to be visited. Is that something that you guys have thought about trying to find a workaround for, or had any suggestions given?
So a lot of that is our hands are tied on based on the guidance we've been given from CMS. So CMS, Centers for Medicare and Medicaid Services, put out a 3-phase plan for reopening nursing homes in early to mid-May. And what they said was each state had to submit a plan that kind of abided by those guidelines to be able to start the reopening process. And right now, Michigan has not submitted a plan back to CMS for approval. My understanding was that was going to happen and be released to the public just before or just after the 4th of July, but because of the increase in cases, my understanding is that's being held back at the moment. So I think the biggest thing for our families to be able to come and visit is to really get some good advocacy around getting that plan out there so that we can at least provide our families with an idea of where the end of the tunnel might be, where the light is at the end of the tunnel, because that seems to be a big piece of frustration for them, because I can't tell them because I don't know and they don't know. And so that seems to be the biggest issue. We have been working on changing some of our processes. Last week, the state did come out with some additional visitation allowances for visitation. So we're in the process of putting together ways to allow that visitation to happen in a way that keeps everyone safe. But that's also a challenge because they're requiring that those visits be monitored, that they're physically separated from their loved ones still. And so that's, where we're running into some of those challenges, but we are getting close on that.
Well, I definitely understand. My recommendation was really going to be pretty simple. I don't know if you guys have considered, or if this is something that maybe you guys could consider just for the families themselves, of providing a low cost tablet with a small data plan for the individuals to use so that they can do stuff like Zoom or FaceTime or other face-to-face interactions. Because I know that a big thing for most of our aging population is being able to have company and have somebody around them. So I just wanted to make that as a recommendation to you. And I know that might be something that's out of your control as well. That may be up to the families themselves to provide that for, but just thought it would be at least worth mentioning.
We actually have already done that. So we purchased 50 tablets for our residents at the very beginning of this. So we've been doing Skype calls, FaceTime. In fact, we had one gal that was FaceTiming her family every day of the week, a different family member. So that is happening. But you know, the hard thing is that's still not the same as face-to-face, and that's what they're really struggling with. But thank you very much for that recommendation.
Thank you very much. Is there any other comments or questions for Destiny? All right, seeing or hearing none. Thank you very much, Destiny. Have a good day.
Thank you. You too.
All right, next item for us today is Department on Aging monthly report.
Yep, hello. I don't think my video's working, so I apologize for that. Let's see if it'll start here or not. Okay. For the report that I submitted, I believe last month I made mention that we would be getting some additional, here, I think my video is starting. 1 second. There we go.
Here you
Sorry.
are.
Thank you. At the meeting I was at last month, I had mentioned that we received some additional CARES funds. And I just wanted to let the board know, of course, that we received $124,464. And these funds do not have to be spent up until September 30th of 2021. So currently we have some CARES funds that we were awarded that have to be spent by 9/30. And that was 98,457. It was split by a percentage to our Meals on Wheels and our congregate program. We requested that 33,000 get moved to the Meals on Wheels side. So we're waiting to get approval for that. So everything's going into the Meals on Wheels because that's where we see the largest expenses right now. To the Meals on Wheels, and we can use that to pay for food, staffing, supplies. They will also allow us to purchase equipment, so we can purchase things like a steamer or an oven. I really see us using it for staffing and for food and supplies. Those are our biggest cost items, but the potential's there if we needed it for a large ticket item. Usually with the grants that we've had, usually you can't purchase equipment. So that was something new that they offered. Again, we're thankful that we're able to use those funds. Between the two grants, we ended up with about $222,921 between the two CARES Act. With our congregate service, the next item I listed on there, we did start the pickup on June 30th, and that's gone very well. Our seniors, when they're coming up, we have kind of allotted times that they drive up, and kind of like a 30-minute window, and our workers go out to the car to double check who the senior is if they're not aware, and bring the meals right to them so they don't have to get out of their vehicle. The seniors were very receptive as far as they thanked us for bringing the meals and putting them into their car. Other comments that I had heard from staff is how much they appreciate just seeing the staff from the Department on Aging. Again, just that personal connection with the department and staff that they're familiar with. And just again, as people have mentioned before, that isolation that people feel and just being able to talk to somebody, they really appreciate that. So that's going well. With our home delivered meals, we're still in the process of figuring out when we can restart our hot meal program. I know our seniors are anxious to resume some kind of hot delivery. So we're making sure that our staffing is where we need it to be with our casual meal drivers once we go to a fuller schedule. So we're hiring some additional staff because some people did not want to return due to the COVID-19 and their situation. But we do have applicants that are applying to be drivers and would like to do that. So we're still planning in that process. It might be late July, first part of August, but we want to work on those schedules. We have our kitchen staff that's participating in the work share program. So we're looking at like a Monday through Thursday hot delivery with on Thursday bringing out like the frozen meals for Friday, Saturday, Sunday. So it is something I think with that daily touching and getting to see the seniors, it's so important. And that interaction that we can have with them as much as possible. So again, we want to work towards that, and we want to make sure that we do it right. So we're just making sure we're walking into that with making sure our staffing and everything's at the level where we need it to be. We've been communicating with our food purveyor, and they're ready for us when we make that transition. And the last thing I put on the report that I submitted, I just added something about the referrals by source, and I kind of looked at our grant period. And it's always interesting to kind of look at data and where the majority of our referrals are coming from. So as you can see, seniors, the majority of the referrals that we get are some seniors calling themselves, looking for services, trying to see what they might be eligible for, whether that's for home delivered meals, personal care. They have questions about Medicaid, Medicare assistance, caregiver support programs, counseling services. There's just a lot of the programs that we do, we get a lot of self-referrals. And then the other largest portion, 25% of that was coming from family and friends. And then the lower areas were coming from like physicians, hospitals, as people are getting discharged from like the medical care facility, we might get a referral for if somebody needs meals at home, things like that. And also then I listed the other group would be community agencies. That might be like Community Action Agency, could be, I listed food pantries, churches. And then I also did something because I knew we did this probably a few years ago. I looked back and it was in 2015. We pulled a similar chart at that time and put it in our annual report. And comparing that, I know our aging leadership, when we looked at that back in 2015, it was like 55% was self-referral, family and friends was 28%, medical was 12%, and community agencies was 5%. And I know as our aging leadership, we really wanted to focus on working to do outreach to our medical field and our community agency. So I do feel like over time, that's an area that we've seen. Yes, you've seen a little bit of percentage drop in that self-referral, but we've had an increase in an area that we were trying to address as far as letting people know, to call us, make referrals to us. So we saw about a 14% change, but again, going to providers in the community, we've increased through speaking to individual agencies, sending monthly newsletters to them about the services that we do through our senior circuit, also brochures. And again, I think participating in a lot of community meetings, like our emergency needs meetings, so people remember to, contact us when they see a senior in need. That's kind of what I had for my report. Any questions?
All right, commissioners, what questions do we have for Danielle today? I don't think we have any questions today, Danielle. Thank you very much.
All right, thank you.
All right. Next item on the agenda for today is the Health Department monthly report.
Okay. Good morning, all. Can you hear me okay?
Good morning, Rashmi. Thank you. Or afternoon now. Yes, we can hear you.
Okay. Let me see if I could start my video. Oh, there I was. Okay. Great. So for the health department report today, I'll just report on a couple of our programs that have still been in effect since the COVID response. For our Children's Special Health Care Services program, this is the program I'll remind you is for families and children with developmental and cognitive disabilities to gain resources in the community and then also to help them navigate through the medical system. We've completed about 91 plans of care there. We did get an approval from the state to be able to do those services remotely. And then the other program that we have continuing is our maternal infant health program, which is our home visiting program. This is included a nurse and a social worker going out and assisting young mothers with getting services and resources. We have also been approved to do telehealth visits there, so we can get reimbursed for those. And we have about 280 telehealth visits that were done, and these were both done during the time frame of April 1st through June 19th. And then on our Women, Infants, and Children program, this is our WIC program that provides benefits and nutrition education for families. As you can see the breakdown of per month. We've had an increase, is no surprise there, considering a lot of individuals are dealing with some financial hardships at this time. So we've had an increase in clients every month so far, May and June, and so far I haven't collected the numbers yet for July, but I would anticipate an increase there as well. We have enrolled since the start of the pandemic. We've also been given approval from the state to remotely provide services for clients in this area. We've enrolled about 462 new families. So staff has been really busy there, and we continue to be able to provide that valuable service, especially when families are continuing to be in need, particularly during this time. And then on the environmental health side, we've been pretty much operating at, we're getting back to, I should say, probably closer to our service levels that we were before. Not quite there yet, given still a lot of the COVID activity and things like that. But as far as our food program, we've had approximately 60% of our license applications returned with full payment of our fees. So moving forward, we'll look at those that haven't been able to pay in full and then provide them with the options for payment as all of you had helped us develop not too long ago. We continue to do inspections of campgrounds and seasonal pools, although with the understanding that indoor pools are still closed per the executive order. And then finally, on the environmental health side, we continue to do our mosquito and tick surveillance activities. And we've been doing trapping of mosquitoes. We'll continue those in 5 different locations throughout our county. One thing to note is that we just issued an advisory today. You don't see that in your report because it just occurred today. I was notified that we do have a little bit we have 5 now.
Rashmi, I'm sorry, we lost you for just a second, like right when you were saying exactly what it was that we needed to be aware of. I don't know if that was just on my end, but I didn't hear what you said before you started.
Okay, sure. I'll start over. The whole piece is on the Lyme disease. We're seeing an increase in Lyme disease in our county. We had 2 cases as of last year this time, and we have 5 now. So we just issued an advisory today to alert individuals to be aware of Lyme disease, the fact that they can do things to protect themselves, wearing long sleeve clothing when they're going out in wooded areas, things like that. So we haven't, through our tick dragging surveillance techniques that we've seen, have actually captured any of those black-legged ticks that are the ones that cause the Lyme disease. But it is somewhat concerning that, we're seeing that increase in activity. So certainly the tick activity is up. So we'll continue to keep an eye on that and keep you informed as we learn more. Does Commissioner Beer have a question?
Commissioner Beer?
Hi, Rashmi. Good afternoon. Lyme disease, if someone has been bit by an infected tick, what are the symptoms? I mean, if I got bit, what would I experience that would
Sure.
tell me I should go see a doctor?
Right. So for Lyme disease, you know, sometimes it can be a slow progressing illness. Individuals that, you know, may present with a fever or something like that, but not all individuals do. I think that the things that you see is like the joint stiffness or the achiness or things like that that may come on. And then, you know, those are things that people want to be aware of, and definitely go see a physician, particularly if they've been bit by a tick, because there could be the potential of that. Great. And then the last part of my report, I just wanted to give you an update on COVID at this point. The numbers have changed since I had given this report to you. So as of today, we have 527 positives, 31 deaths, and 432 have recovered. So I'll remind you that recovered means that they haven't had symptoms for a period of about 30 days. And of course that they're alive at this point. And then on the statewide front, our numbers today are 69,338 positives, and then 6,068 deaths. So one thing that I think we're going to be looking at is we did issue a press release that many of you may have seen over the last week, I think it was, that we issued that press release, that we did notice a noticeable increase in our COVID cases. And a lot of those have been attributed to individuals who have traveled out of state, particularly Tennessee and Florida. So we're going to be looking at developing a policy, at least for our county employees. If you had traveled out of state, you know, that we're doing some level of consulting with the health department, that way that we can say, you know, you do present with the risk, you're going to have to stay in quarantine for 14 days, you know, things like that. So, you know, that was concerning, and we certainly look at other states as well, because there's activity going on in other states that may be higher than Michigan. So we're gonna be finalizing that policy here very shortly.
Hey, Rashmi, if I may, Mr. Chair. If I heard your numbers correctly there, you said there was like 69,000 positives and 6,000 plus deaths. Isn't that like 9%? That can't be right. The death rate is nowhere near 9%. So what is that number really representing?
So the 69,000 is the total number of positive cases, and then the 6,068 deaths that are in the state, that's statewide. Yeah, the state fatality rate, it's somewhat misleading on their state website.
Well, it's like 9%. That's a whole lot misleading if that's really what they're trying to tell us.
Right. Yeah. And I think, you know, early on, I don't know if they necessarily captured a lot of the information of individuals that, you know, maybe they're just capturing a lot of those high risks later on as the event progressed. But, you know, it's certainly not something that, you know, we go by as far as for our fatality rate in our countywide. You know, we do maintain we do.
Well, while she's paused, I'm just confused. I don't understand how the state can report we've had this many cases and this many deaths, and wait, something's wrong.
Yeah, I'm not entirely certain how they, you know, how they're getting those numbers really, but I just know even for our county rate, you know, it's at a third of those are from nursing home deaths. So really our fatality rate continues to remain fairly low as far as a county. But yeah, I don't know the state's numbers really. You know, that is misleading as terms of the fatality rate and why it's so high. Unfortunate.
Yes, it is. Thank you.
I think that was it really that was it for my report. I just wanted to also mention, though, I heard Destiny indicate that they had used the National Guard for the testing of the nursing homes. The unfortunate thing with that is that the National Guard utilized a lab called BioReference that has been delayed in getting their results back. As you can see, Destiny indicated that they're still pending results and waiting on those results. We tried to get the state to allow the National Guard to utilize our local labs here, They didn't want to go for that, unfortunately, but you know, that has been quite a challenge in terms of utilizing the National Guard at this point. So we're still waiting on several pending results there. I think that was the end of my report then, unless there are other questions.
Looks like Mr. Kennedy has some questions for you.
Good afternoon, Ray.
Good afternoon.
So reading your report, there's of these new cases in Jackson County, 2 are reported to be hospitalized at Henry Ford. Is that the only hospitalizations in the county that you're aware of?
Yep, it is. I just checked the Henry Ford site. Thanks for bringing that up. I just checked the Henry Ford site today, and there are only 2 individuals hospitalized at this point.
Okay, and then my second question is, through reading some stuff about Michigan as well as some other states, on some of these new positives, there's been some confusion as to what test is confirming the positive, meaning they were lumping in people that had antibodies for it but had recovered and being counted as a new positive result. What form of testing are we using? Are we using one standardized test?
So yeah, we're not doing the antibody testing here in any places in our county. There were a few places around the state that were doing antibody testing, but the antibody testing is not meant to be a confirmatory or diagnostic test to let you know if you have COVID. So the ones that Henry Ford and Center for Family Health are using, they're consistently using our nasal pharyngeal, you know, if you're familiar with the swabs that they're utilizing, and then taking samples of their nostril areas. So that's primarily the only test that's being used here in our county. So we shouldn't have that, you know, the false reports coming back from antibodies, if you will, from our reports.
Okay, thanks.
All right, commissioners, any other questions, comments, or concerns? Commissioner Shotwell.
Rashmi, you were sharing with me before last weekend about the people traveling Florida and Tennessee. This past week, Washtenaw County has announced that large gatherings that had gone on over there over the 4th now are showing large positive tests in the area of 60. Do we have any of those people that have come into Jackson County or any of the events that went on during the last 2 weeks? And should we be concerned about people coming in from outside Jackson County to organizations or meetings that are going on here in Jackson County?
Sure. So I did hear about those couple events that happened in Washtenaw County. You know, I don't know for certain if our cases, I'll have to double check with nursing staff to see if any of our recent positives have come from those events specifically. But, you know, it's likely that we will see over time, you know, positives coming from different events going on neighboring to our county. You know, so far, knock on wood, but I imagine we'll have contacts of those that were at the East Lansing bar at Harper's. Certainly there was quite a few individuals there, and I'm frankly kind of surprised we haven't seen any yet, but I imagine we likely will as contacts of contacts continue to be contacted. So yeah, I mean, I think, you know, we're going to see individuals that are, you know, traveling outside of our county certainly too, that mandatory 14-day quarantine, I think, could help in some regards if we know people who went out of state. You know, I don't know how enforceable it really can be as far as people, you know, just traveling outside of our county and things like that, how much of that we can do within our own county employees and try to, you know, contain that. But really, as far as the general public, you know, I'm not sure how much of that, you know, we'll be able to enforce. Individuals travel outside of our county like every day, really, so.
All right. Thank
Froze,
Any other questions?
You're pretty froze up. We can't hear you, sir. Can't hear you or see you.
And who's vice chair?
I'm the vice chair. You want me to give him a minute, though?
Yeah.
I'm here, so if I have to.
Perfect, thanks.
No.
Daniel, I can see you finally, but can't hear you. Haven't heard anything from you the last minute or more. I don't know what can be done with the connection.
Maybe voice only. You know, like turn off the video. Maybe it's got enough bandwidth for just the voice.
Can you guys hear me now? Okay.
Yes.
All right. Sorry about that. The joys of technology. Did we move forward on anything? No? Okay. So next item is we need a motion and support to pay the claims. All right. I see Kennedy and I see Mr. Bear. All in favor say aye. All right. And opposed the same. All right. Bills are paid. Next item is other minutes. So if you want to take a look, the DHHS board minutes are on there also for your viewing pleasure. And then the next item is August reporting schedule. So in August, we'll have the Department on Aging, Health Department, and Lifeways. And we are now back to public comment. Is there any public comment?
Negative.
All right, seeing or hearing no public comment, is there any committee member comments? Mr. Bear?
All three of these meetings today, the system has just kicked me out. I've had to rejoin all three of these meetings. I don't know if that's something Michelle can address. I know it's happened to Commissioner Elwell quite a few times, but every meeting today it happened to me. So don't know what we can do.
I will concur with that, Mr. Bear. I was actually going to ask Michelle, maybe
You're up.
I think he said he was going to ask me if I could do anything about the question.
See if there's any throttling on the bandwidth.
If I may, this is Michelle, address the technology concerns.
How about now?
There's really
No.
nothing that I can do about it. Depending on your different area, it has to do with the bandwidth and your network connectivity. Daniel, I could try to work with you and see how you're connecting. Yours seems to be the worst. Tony, with this disconnecting, it has nothing to do with anything that I have control over. I apologize. I wish I could make it better, but it has to do with the platform. I can show you a log and just to show you that I'm not doing it just to upset anyone. So just to CYA, if you will, but I can work with you to try to figure out if there's any drivers or anything with iPad, but I will specifically say that it's more or less bandwidth issues, your area, or checking to make sure that your device is updated, but it's not anything that I can help with. I'm sorry.
Ms.
I think you said Kennedy.
Ford,
Yeah, okay. It'd be fine if we came in and conducted the meetings inside the building as long as it was Zoom format. We would get a better signal at the county building than our homes probably. Am I correct in assuming that, Michelle?
I would like to say yes, you were, but I cannot say that. It has to do with the connectivity of the Zoom platform. It could be that we have a better connection here. However, the court system is hammering the Zoom sessions. They're taking a lot of the county bandwidth. So I would like to say yes, but if you want to go somewhere where your bandwidth will not be interrupted, I would recommend the event center.
Commissioners, if I may, I'd like to add that there is a feature in Zoom where you can go to the mute button and pull up the little menu, and you can actually connect using your telephone by dialing with the numbers, but you have to put in the meeting ID and then also your participant ID. So what that'll do is synchronize your telephone with the Zoom call. So even though the video will cut out per Michelle's comments about bandwidth, the audio still continues to come through loud and clear. We've learned to use that here at JCDOT with good success, and that's what I'm using right now, actually. And you can either mute on your telephone or in Zoom, and it synchronizes your phone for muting as well.
Good point, Christopher. If you add the participant number in on the phone, that will allow you to only have the one session tied to yourself. So I had thought some of you might be using a phone, but that is a good suggestion.
all right, thank you very much. I had other comments, but I will just email you my other comments just for the sake of time and the possibility of breaking up as soon as I start saying something important. So if there's no other comments from commissioners right now at this time, oh, sorry, Darius.
Just a question, more or less for the chair or administrator. For our next meeting next week, are we going to be doing that via Zoom or will we be in person? Zoom, okay, thank you. Nothing further. That's all I had, Mr. Chair. Thank you.
All right, any other comments, questions, or concerns from the? All right, I don't know if you guys can hear me or not, but we are adjourned.